Now we will scanning the epigastrium by using convex probe by placing in transverse position. Here we see a large cyst containing debris at epigastric area. This is left lobe of liver. Now we will continue scanning to find out the origin of this cyst. Now tilting the probe downside, the cyst is continuous with the duct. Now we will scan the pancreas. Here we see the splenic vein which is compressed by the cyst. And this is pancreas. The visualized part of the pancreas shows homogeneous texture and normal. Now we continue scanning the pancreas. We see that the cyst is continuous with the body of pancreas. Now we will measure the volume of this cyst. The volume of this cyst is 561 milliliter. Now we will scanning the pelvis. This is urinary bladder which is full. Here we see the free fluid in the pelvis. Now how we will write report.